Welcome, everyone. If you're just joining us, we're going to wait just another minute and then we'll go ahead and get started today. We're glad that you're here. Okay, welcome everyone. We are so glad that you're able to join us today for this important discussion around big tobacco and the ways that that marginalized communities are targeted by big tobacco. I am so excited to introduce our moderator for today's panel, Selena Morrison, the Executive Director of the Office of LGBT Affairs. Since coming to Philadelphia from North Carolina more than a decade ago, Selena Morrison has been a vocal advocate for LGBTQ+ residents with a particular focus on the transgender community. Providing support, education, and resources throughout the community is a passion of Selena's, and she's devoted to making a difference in her community. Her advocacy work is driven by her desire to always be of service. Prior to joining the city, Selena was the Director of Programs at the William Way LGBT Community Center. She previously served as Community Engagement Specialist at the Mazzoni Center for several years, providing education and support resources for the trans community, and as a recovery specialist at Morris Home. Selena has also been a support specialist for the PACS program, a collaboration between CHOP and Mazzoni Center. Personally, I am thrilled to introduce my friend and colleague, Celena Morrison, who will be moderating our panel tonight. Hi, Celena.
Hi, Allie. Thank you so much. Hello, everyone, and thank you for joining us at tonight's event. This is the second in a two-part series addressing the ways that tobacco use harms LGBT communities and envisioning how, the possible alternatives. Again, my name is Celena Morrison. I use she and her pronouns, and I am the Executive Director of the Philadelphia Mayor's Office of LGBT Affairs. Our office is so appreciative for the work of our partners in producing this event. The Philadelphia Department of Public Health, the William Way Community Center, and Health Promotion Council. For this evening's event, we are joined by a fantastic group of panelists, including Lincoln Mondy from Black Lives, Black Lungs, Dr. Scout from the National LGBT Cancer Network, and Dr. Christopher Wheldon from the Temple University College of Public Health. Tonight's session will focus on the predatory marketing of the tobacco industry and its impact on the LGBTQ communities and communities of color. We hope that raising awareness of these injustices will help create a cohesive, mobilizing voice against the tobacco industry. If folks have questions for our panelists, please put them in the chat and we will address those during our Q&A at the end of this evening's session. We respectfully ask that everyone who is not a panelist, please keep your cameras and your microphones off. And to start us off this evening, I want to start with a question directed for Lincoln. First, Lincoln, I want to thank you for joining us.
It's so good to be
I'm
here.
so excited to have you here. I understand your work focuses on ensuring that young people are set up to lead safe and healthy lives. Part of that work includes the development of cultural change campaigns, including your powerful short film, Black Lives, Black Lungs. It's amazing. Can you share with us some of your work around that?
Yeah, of course. Thank you for having me and everyone at the office and for inviting me tonight. Yeah, so I am at Advocates for Youth, which is a national nonprofit focused on young people's sexual health and rights. I really I have the privilege of creating visuals, whether it's a YouTube series for LGBTQ youth of color called Kiki's with Louie, or an animated series educating all young adolescents around their bodies and their futures, or brand partnerships with Trojan around making sure people have access to condoms, or just talking about sex and sexuality since they're so shamed and stigma and misinformation. So I really love my work at Advocates because it does kind of meld with my film Black Lives, Black Lungs, because at the end of the day, I made that film to really educate my community. I really didn't see a lot of information, awareness. I didn't know about the issue or tobacco industry, the tobacco industry successful campaign until I started working with Truth Initiative. So I'm really privileged to be able to work with youth activists at Advocates for Youth around issues ranging from reproductive health to HIV modernization laws, and also working with young people focused on public health and the health and wellness of the Black community.
Thank you so much. I think it's amazing the work that you do. I understand. Did you have a presentation or something that you wanted to share?
Yeah, of course, a little something. I just wanted to put it live, but yeah, I am really proud of this film because it wasn't just me. It was a lot of people at Truth Initiative that I leaned on, as well as fellow public health youth activists, but also just, the seasoned elders in our community who've been working on this issue and sounding the alarm about this issue for years. I wanted to just, before I get in a little deeper into the issue, I wanted to just start off with a quick trailer of the film, Black Lives, Black Lungs. So without further ado, I'll play a clip of that if the host will grant me privileges to share. There we go, perfect. Awesome.
Great. This is better. I'm glad you're showing that.
3 years ago, I accepted an internship with Truth Initiative. At the time, I thought I knew everything I needed to know about tobacco, but what I knew was just the beginning.
One of the greatest marketing coups that took place in the 20th century is transforming menthol cigarette to a black cigarette.
During my time with Truth Initiative, I read dozens of research articles and stacks of internal documents directly from tobacco industry files. The tobacco industry strategically and successfully infiltrated my community. And while it's true that they targeted many groups, the targeting of the Black community has been uniquely damaging.
So it was good to see Black people in the ads and to see that there were Black models and that people saw that and they were very much attracted to that. It was sort of a double-edged sword.
They do target everybody, but when they target us, we die disproportionately from it.
We know the facts. We have the scientific knowledge that tells us that we die in larger numbers.
Tobacco-related diseases are still the #1 cause of death in the African American community.
47,000 African Americans a year die as a result of tobacco-related diseases.
Somewhere in the neighborhood of 90% of all African American civil, religious, political, social organizations take money from the tobacco industry.
Behind the scenes, there were negotiations between the leaders of these organizations and tobacco companies.
Because there's money tied to it. And money makes things happen. Because of who we are, our lives are constantly at threat. Black Lives Matter, hands up, don't shoot. I can't breathe. I think we're all answering the same question. What is the worth of a Black body in the United States of America?
Yeah, so it's kind of wild to think that we released that in 2017, and obviously a lot has happened since then, but I am proud of really the framing that my film helped usher into the public health space, because as someone who was entering it in college, I didn't really, see room for me at the time. I didn't really see, it was either you're through and through like expert researcher, scientist, et cetera, or you're a public health major, where I didn't really see a lot of room for creativity at the time until I started getting connected with people at Truth Initiative, where I had an internship that developed and developed and developed to here we are now, I think 7 years later, to really focus in on providing my generation, a younger generation, with the tools and resources to really understand tobacco industry's infiltration into our community and kind of the impact that it's had, right? I was very intentional about making the film from a point of view that didn't assume knowledge on anyone's point, and also understood that all of these things are, of course, like interconnected. And at the time, I felt like there was some pushback to me focusing or having a social justice framing lens. But of course, as you all know, and what we know at Advocates for Youth is that a young person's health is impacted by their citizenship status. It's impacted by their zip code. It's impacted by their race. And to not acknowledge that in this space, I think was a really big gap. And so I'm really thankful for everyone who worked with me on the film, and to see specifically the experts who've been doing this work for decades, like Dr. Phil Gardner and Dr. Kel Magruder, get their flowers, and also just have a storytelling platform to kind of mobilize a community. So I know that we're going to have time for some Q&A. I just wanted to quickly go through a couple of slides to give you a couple of more kind of context points. So like I said, I produced the film alongside Truth Initiative, and it was released in 2017. And really, I really want to start with, I think many of you may know on the call, but something that I didn't know when I was making the film, and something that a lot of people have been surprised about, is just the nature of what menthol is. I think in popular culture, I grew up with a Black family who, if they smoked menthols, and my white mother and my white family, if they smoked, it was non-menthol, and most of the time they were using chewing tobacco, right? So even at a young age, having a mixed family, I saw the differences, and I just assumed that everything made sense. I assumed that menthol was just a part of Black culture without asking the questions, until I started researching and doing the work on this film. So menthol is just really a chemical compound. It actually masks the harshness of tobacco, since you have a minty flavor additive covering up the harshness of tobacco. So research shows that it's easier to pick up menthol cigarettes and harder to put down. So I always get the feedback with this film, and I was traveling before times to different Black churches and community groups and the NAACP convention, and a lot of pushback is, of course, big tobacco targeted everyone, right? But when you look at how the Black community was impacted and what they were targeted with, which is menthol, which again is easier to pick up and harder to put down, that's where you have the damning evidence, right? So if you get a chance to take a look at the film outlines all the routes that the tobacco industry took to target the Black community with menthols. Basically, it was a 50-year marketing, PR, crisis comms, whatever you want to call it, plan, funneled with billions of dollars to make menthol a Black cigarette. And they were successful. That's why there's the Dave Chappelle menthol jokes. We have the cool jazz festivals. They were successful in attaching this specific menthol product that they knew was more harmful than other products to the Black community. They did this through a lot of different ways, and my film outlines that. But there was point of sale advertising is more dense in Black neighborhoods with menthol. There's more free coupons and giveaways. I mentioned they have the cool jazz festivals. They donated money to the African American Smithsonian Museum. All of these things to really focus in and kind of capture their target audience to a really damning point. If anyone watches my film or listens to anything I say, I think the biggest thing I would want them to take away is just the rates of smoking, right? So when all this started in around 1950, when the first menthol product went on the market, out of the people who reported smoking, for African Americans, it was around 20% at the time in terms of smoking menthol. That's ballooned to where we are now, where nearly 7 in 10 African American smokers smoke menthol compared to around 20% of their peers. So the industry, through all these myriad of ways, are really successful in making menthol a Black cigarette and infiltrating it into our communities. As you saw in the film, they use a lot of very, very smart strategic tactics. At a time when Black people couldn't get a job or sit at the lunch counter, they had, Black athletes as models and Black ads, and using a lot of money to pump into Black magazines and Black print to really, again, as you see, it's all menthol products, right? Even the before earlier times, the Black and white photos you're seeing, those are still menthol products. And that's kind of how ingratiated it is in our culture and our media. there's evidence and there's videos and everything of tobacco companies driving in. This is Detroit actually driving into what they call, ethnic neighborhoods and just dumping cigarettes and just giving them away for free. This has now changed because of obviously laws to them giving coupons, right? So they're not on that side of they may not be on the side of the street handing out cigarettes, but they're still strategically placing menthol coupons in Black neighborhoods. A lot of other kind of entry points into the Black community was through our own organizations. So organizations like the NAACP, the Thurgood Marshall Fund, all were funded, and still some of them are funded through Big Tobacco. My film specifically calls out the Congressional Black Caucus Foundation, since Altria, as one of the world's largest tobacco companies, was a major donor for the Congressional Black Caucus Foundation at the same time as menthol bans were leveling to the national landscape. So a lot has happened since I released the film in 2017, but not a lot has changed, right? Big Tobacco is just coalescing their personnel, their profits around a new product, which is e-cigarettes. Big Tobacco's main strategy and campaign right now is to have the public and you all perceive traditional tobacco and e-cigarettes as two different beasts, two different industries that can't possibly be regulated alongside of each other. And right now I'm working with Truth Initiative on a second film to follow up specifically about how Juul and other e-cigarette companies now with Big Tobacco elder leaders and a board and ownership by Big Tobacco, how they are just dusting off their old practices and using the same key kind of loops that Black Lives, Black Lungs unveiled now in the name of e-cigarettes. So one example of that is that I was invited to Meharry Medical College last year, where Black students invited me for a town hall because their school, a medical college, a Black medical college, accepted $7.5 million from Juul, even though they had a policy to not accept Big Tobacco funds. But since Juul, has been successful and Big Tobacco has been successful in kind of making two different lanes, the medical school accepted the funds and will not be giving it back on the basis that they do not see Juul as a Big Tobacco company. So these are the kind of updated ways they're using. They're still hiring Black lobbyists and Black staffs. Most recently, Ben Jealous of the NAACP is on the payroll at Juul, as well as Chakra Burgess from the Congressional Black Caucus Foundation and Heather Foster from Obama's second term cabinet. So I think the time is ripe to make sure that people are aware of the strategic targeting of the Black community by the tobacco industry and also kind of how they're using these same tactics. So I'm excited to listen to my peers about how the industry is targeting different populations, especially as being as a Black queer person. Obviously, when we're talking about Black Lives, Black Lungs, it's also at the same time as, I'm visiting places with pride parades and they have like Big Tobacco tents and like merch and stuff. So obviously a lot to be done, but I'm looking forward to the Q&A section and thank you for having me.
Thank you so much. I'm looking forward to hearing more about all the work that you're doing. I know that a lot of us are also really involved in some of the work around smoke-free pride. So I look forward to sharing some of that with you. Next, Dr. Scott, thank you. Thank you for joining us, Dr. Scout. Thank you for your work as the Executive Director of the National LGBT Cancer Network and the Principal Investigator of the CDC-funded LGBTQ Tobacco-Related Cancer Disparity Network. That's a lot.
It's a mouthful.
Can you share a bit about the work that you do in this important field?
Yeah, absolutely. Thanks very much. And hold on a second. Let me go to a screen share. How's that?
Great.
There we go. And then let me move to actually present mode. Can everybody see that fine?
Yes.
Can you see that? Okay. Okay,
Yes.
great. Okay, excellent. All right, so I'm gonna run through a little bit of some history related to this and also where we see this pivoting to happening today, because as Lincoln pointed out, it's really shifting, and the tobacco industry has got so much money that they can, they can split into 26 different things, and they'll have us running after all 26 of them. And so it's a hard place to kind of keep on top of what they're doing right now. So first of all, just as a kind of a briefest summary, as Lincoln had talked about, there's a whole bunch of targeted marketing that the tobacco industry does. We've got stuff that goes all the way back to like in the 90s with the LGBTQ communities, where actually we've got some stuff, it's a whole thing they have around California where they actually in their own documents say, well, we don't really want to target racial or ethnic minorities because we don't want to be seen as targeting. So let's target the queers because that won't be seen as targeting somehow. So they actually recruited one of our big leaders, and then that leader ended up giving them messaging for why it was in the 90s we would be able, the leader had said, LGBTQI plus communities is not particularly a supporter of tobacco, but we could neutralize them on this tax vote that's coming up. And we could do that by capitalizing on messages like hands off our bodies, it's our right to smoke, don't interfere with our lives, which of course at the same time that consensual gay sex was illegal in this country. And so we were doing a whole bunch of, hands off our bodies kind of organizing and things like that really resonated with a lot of people. So during that time, you saw not only as we see this, there's this history of menthol targeting, particularly for the Black and African-American communities that goes way back to World War II. You also see subdivision targeting for other racial and ethnic minority populations. And then you see things like the Parliament ad we had there, which if I can get my own thing off the screen to see it. Yeah, so that was like, that was the type of ad that they put into LGBT magazines, just as kind of like vaguely queer to kind of be approaching us. And we did have during this time, we had a bunch of our own media in our communities say that they could not refuse tobacco industry money. Why? Because very few commercial entities were actually marketing to us. So when tobacco industry came in first with open hands, big piles of cash, a lot of our media said, sure. So this is one example of kind of ads we'd see, but then the next one goes on to some of the more specific LGBTQI things. And the one on the left is a little hard to read, but I'm gonna read it out loud. And this is an example of that, that one organizer who said, these are the kinds of messages that really resonate with us. Basically, make the tobacco industry messages look like civil rights messages. So this one is freedom to speak, to choose, to marry, to participate, to be, to disagree, to inhale, to believe, to love, to live, it's all good. And that's an American Spirit ad. In the same way, we also have another one from a pretty contemporaneous time from R.J.R. Reynolds that says, whenever anybody says, dude, that's so gay, we'll be there. And of course, I don't think R.J.R. Reynolds is actually going to be there in case we ever hit any anti-LGBTQ hostility on the street. But they like to tell us that they were their friend. In the same way, as Lincoln also talked about, there's a huge philanthropic investment in our communities. It was estimated in the 90s that Philip Morris put more money into bragging about how they were a good LGBTQ plus employer than they actually put into any LGBTQ plus causes whatsoever. But at that time, when there were welcoming employers, they really stood out from the pack. Nowadays, it's a little more common to get welcoming employers. But at that time, they really took a leadership. Like if Philip Morris wasn't selling death, unfortunately, they would have been great. A model employer we would have wanted every other organization to follow, right? But you see now it's continuing to this day. And in each of those ads to the right, these are ads that don't even have to do with cigarettes anymore, right? So first of all, we got snus, which is the little tobacco packages you can put in your mouth. And then you have blue, one of the ways of getting nicotine in that doesn't have to do with cigarette. Why are they using all these other ways to get nicotine in without cigarettes? Simple thing, cigarettes are being legislated and there's more and more rules on them. So the tobacco industry is just able to create new things as a way to get you addicted to its product. So just again, as like this big arc history of what we've seen, one of the things that stood out from the tobacco industry documents we saw was that on one of them, R.J.R. Reynolds was talking, they had a project called Project Scum, Subculture Urban Marketing. And that was targeted at gay men and homeless people in the Tenderloin of San Francisco. So at the same time, they're saying like, we're your friend, we're gonna be there if anybody says it, dude, that's so gay. They're also behind the scenes being like, Project Scum is gonna target gay men. So, and it actually was gay men, not LGBTQ+, but that's because at that time, it was something probably more contemporaneous language related to it. So you can definitely see a very different public versus private position by these companies. Because of course, whenever they get a user most often for life, and they get a huge amount of profit off them. Then, as Lincoln also mentioned, there's Pride Festival sponsorships are still going. It was like 3 years ago, I think, that Miami's Pride Festival was sponsored by vaping companies. And, you know, it was a few years ago that in St. Louis, Missouri, they came in, their Pride festivals during a very hot time of the year. And the tobacco industry does nice little sweetener things, which for them are, you know, less than the cost of a rounding error because they have so much cash. They're like, well, what about if we bring in the only air conditioned area in Pride? We'll bring in a bunch of big vans that are air conditioned, and then we'll have a special air conditioned smoking area. Well, as you can imagine, that's really enticing with Pride. It's the kind of thing that it's hard for Pride organizers to say no to. Part of what we also see is there's some reports of other types of things the tobacco industry did. Like, for example, the most notorious was in North Carolina, where one of the Pride organizers was literally, according to what they told me, offered any kind of car they wanted if they just would let the tobacco industry underwrite Pride. So again, when you're dealing with an set of organizations that have so much money, is that story true or not? I have no idea. But when they have so much money, and the truth is we're pretty inexpensive to get advertising in a lot of places. So it means they can be really effective in doing that. You also saw that there's a bunch of different ways that they would also seed this into our communities. As I talked about, Philip Morris bragged about what a great employer they were. And we also saw that there was actual a targeted effort to try and get more smoking into LGBTQ+ films. And people done some analysis of our own media, and they basically find out that because of that history of all the advertising that's gone into our own media, to this day, our media is much more likely to say neutral or positive things about smoking than they are to say anything that might be negative about it. What kind of counter marketing has there been? I hate to say it because it's kind of embarrassing. The counter marketing has not been as sophisticated. So this is tips from former smokers. We don't like these ads because they're really stereotypical and they haven't done new ones. So we'd really love it if they update that. There was a great freedom, there was a great campaign that I'm blanking on the name now, but the government closed it down. It was actually a really big youth focused campaign, and the government closed it down. So I'm not going to bring it up because it doesn't exist anymore. So because we don't always love those government ads, we started to create some of our own. So if you're interested in doing this kind of work or promotion or outreach, you can use these ads we have for free that show a much greater diversity of our own community members and have a wider range of kind of like really showing us as we are, things like that. So we offer these to states, to governments, to any kind of tobacco control agencies around the country. But where is this going now? As we know, it's changing to new types of things. But we also saw, even when there were what's called CIA battles on the screen, there's clean indoor air, legislative battles about banning smoking inside. We'd see that in several different states, St. Louis, Georgia, Rhode Island, where I am now is one of them, they would take off an LGBTQ leader, NDC2, and pay them to stand up and say, hey, wait, we're going to be hit harder. Our communities are going to be hit harder if there's clean indoor air laws passed. And they'd use that politics of kind of dividing the community into a group that you were hopefully some people were caring about, and then using that community to misrepresent its actual position. Because actually, if you asked LGBTQ+ people and surveyed us broadly, we said we were more likely to support clean indoor air than even the general population. But the tobacco industry would just hire one of our leaders to speak up and say, that's bad, that's bad. And in several cases, we get these laws delayed. What we're seeing right now is a very similar concept is happening because the new legislative front is not as much clean indoor air. Now it's bans on flavors. We saw that, as Lincoln pointed out, menthol, mint, which LGBTQ+ people disproportionately use and African-American populations really disproportionately use, is something where it's still being allowed in cigarettes, even though every other flavor of cigarettes has been banned. So there's a systemic racism baked into this policy right now. And in the same way, right now, youth aren't using the cigarettes to start. 1/3 of our youth are starting because of vaping products and other e-cigarette type products. So the way to get in is absolutely through these alternative products, where flavors are off the charts right now. They're all over the place. And so what we're seeing as states start to look at banning these flavors, not the products necessarily, but the candy corn and flavors like that, which really entice youth, is that they're again taking community of color leaders or LGBTQ+ leaders and having them stand up and say, hey, it's gonna hurt us. In this case, Al Sharpton is on this picture because there's been a famous kind of a battle between African-American leadership with public health leadership and Al Sharpton. Al Sharpton says it'll hurt us because if you ban menthol, there will be more law enforcement interactions with the African-American population, which of course all of us want to avoid right now, no question, right? But on the other hand, all these public health experts in the African-American community are saying, but if you don't ban menthol, more of us are going to continue to use something that kills us. So it's a real challenge. And the last thing I put down here is that I actually recently ran into a tobacco industry sponsored LGBTQ plus leader who has been going around to different conferences presenting about how vaping is the harm reduction answer for our tobacco disparity. So we're actually, I don't know, I should be happy that we're getting this extra attention, but we are getting kind of that leadership within our own population to change the types of things, to subtly create a different voice within our own communities. So the last thing I'm gonna kind of say here is, so we're starting to push back against some of this flavor ban stuff and starting to help organize some of our community members around this. And I'm going to play this little 30-second spot to show an example of kind of things we're advertising.
Did you know right now 1/3 of queer youth are getting addicted to nicotine through vaping?
Because vaping comes in flavors like Candy Crush and Fistful of Fruit and menthol.
Is that the healthy future you imagine for our next generation?
Banning all flavors in tobacco products is a social justice issue for us. Did you know right now
Okay, so that's that. We're starting to push back against it. And the last thing I just want to say is we've got a big survey around cancer survivors out. So we're looking for anybody who might be able to spread the word broadly about that. And with that, I will turn it back over to you.
Oh, okay. Thank you so much, Dr. Scout. If you would like to put the link to that survey in the chat,
okay,
that'd be helpful for folks to be able to share that out.
I will absolutely do. Thank you.
Thank you so much. And thank you for the work that you do.
Now let me stop sharing the screen so we can get back to the main thing. Okay, there we go.
Okay, thank you. Next up, Dr. Wheldon. I understand your work as a behavioral health scientist involves reducing cancer disparities and improving cancer care for underserved and vulnerable populations. Can you tell us a bit about your findings and experiences in that area?
I would love to. I'm going to share my screen because I'm going to report some numbers, which is something I love to do. Could you allow me to share my screen?
Yes, I think you should be. You should have permission.
So as a cancer prevention researcher, I focus a lot on behaviors that we could modify to prevent cancer. And obviously one of those is tobacco. So one of the impacts of differential tobacco marketing to LGBTQ communities is that some members of the population use tobacco at higher rates. So I'm really interested in exploring and monitoring the uptake of different types of tobacco products based on identity, gender identity, and sexual identity. So to borrow from the words of the great Tina Turner, what's identity got to do with it? That's what I want to talk about this evening, and specifically focusing on sexual identity and gender identity. And most of you are probably familiar with these terms. Sexual identity we use to describe how one thinks and feels in terms of their romantic and sexual attractions, whereas gender identity is a person's internal identification with being male, female, both, neither of those, or something else. And we often use words like gay and lesbian or bisexual to describe our identities, but we see increasingly emerging identities related to pansexuality or queer or even asexual. And I'm going to talk about those and how those might relate to different patterns of tobacco use that we're finding in some contemporary data. So I like to think of identities as sort of proxies for the day-to-day lived experiences that may impact tobacco use, imperfect proxies for sure. And we know that the causes of tobacco use are multifaceted. So we have differential exposure to stigma and violence in our communities, which leads to social stress and different mental health concerns, social norms regarding sort of bar culture and sort of descriptive and injunctive norms that promote tobacco use from within our own communities. And then we have tobacco marketing that, as we've talked about already, is differentially focused on LGBTQ populations. So I'm sort of interested in exploring what the impact might be in terms of the types of products that LGBT populations use. So I'm going to talk about a couple studies that I've conducted using the PATH data, which is a national sample of over 32,000 adults in the United States. Now, surveillance data is really important, and historically we haven't asked questions about sexual or gender identity in these population-based surveys. But increasingly, and this is a study that's conducted by the FDA and the NIH together, they have started to add these questions to the survey. So they give us powerful tools to monitor at a national level what's happening with our communities. And I also want to talk about a study that was conducted in collaboration with the Human Rights Campaign, and that was a study of youth. So they surveyed youth, LGBTQ youth, between the ages of 13 and 17. And that was over 11,000 youth. And it gives us a lot of information about how gender identity and sexual identities intersect to create differential exposures to tobacco product use. So I'm just going to get into the numbers, and then we can follow up with that with a discussion of these. So what you're looking at here is what we consider established or regular use. So this isn't just trying it, this is established use of these different tobacco products. So we have cigarettes, cigars, e-cigarettes, pipes, hookah, and smokeless tobacco. And this is among cisgender men 25 years of age and older. And we know that by the age of 25, anyone who's going to really, almost 99% of those people that are going to establish regular tobacco use will have already done so. And this is data from the PATH study. And what we found were some interesting patterns here. So obviously we see that cigarette use, traditional combustible cigarette use, was the most common type of tobacco product used. But we see statistically equivalent rates between straight, gay, and bisexual men, which is kind of counter to what we find in some other studies, sometimes using convenience samples, where we see much higher rates among gay and bisexual men. So in this study, we found that there actually wasn't a huge disparity in cigarette use. With this group that sort of identifies as something else, we found a lower rate. So I just want you to keep that in mind, because I'm going to talk a little bit more about that in a minute. What we did find, however, was that bisexual identified men used cigars and pipes at a much higher rate than anyone else in the population, including heterosexual men. And we found, however, that heterosexual men were the ones who are using smokeless tobacco at higher rates, much higher than gay identified men and a little bit higher than bisexual men. So the differences in tobacco use in these men is sort of nuanced, and it seems that identity is associated in some ways with the choices around specific types of tobacco products that people are using. So when we look at data from women, and again, this is cisgender women that are 25 years of age or older, we see a different pattern completely. So in contrast to men, lesbian and bisexual identified women had much higher rates of cigarette use than straight women did. And we also see lower use among this something else group. So just keep that in mind for a minute. We're going to turn to that in a second. We found that lesbian and bisexual women also had higher rates of cigar and electronic cigarette rates. When we do look at the younger sample, we see that these uses of electronic cigarettes, as we would expect, is considerably higher. But because this is a somewhat older segment of the population, that use hasn't sort of diffused yet to older ages. So it is still relatively low among this group, but we still see differences in bisexual and lesbian identified women. And for the most part, hookah use was uncommon, but we did find slightly elevated rates, but it wasn't statistically significant. As regard to pipe use and smokeless tobacco use, the numbers here were very low for women, and they weren't statistically reliable, so I'm not reporting them here. But I do want to also note this: just 1% of those who identified that their sexual identity was something other than what was presented in the survey had much lower use. So when we look more closely at that, this is sort of how the question was framed. And the survey in the PATH question had gay or lesbian as one option, straight, and this is a standard way of asking this question, that is not gay, and then bisexual, and then something else. And the interesting thing is when we ask and follow up, what do you mean by something else? We saw that about a quarter of men and women meant that what they identify as is asexual. And this is adults 18 years of age and older. And what we find that's interesting with regard to tobacco use is that people that identify as asexual had the lowest rates of tobacco use across all of these products I just mentioned. And just to give an example, remember we had about 50% lifetime usage rates of cigarettes among the other groups, but it was just 23 and 25% in this asexual population. So this finding is actually very consistent across findings when we expand our definition of what we consider sexual gender minorities to encompass people who identify as asexual as a part of their sexual identity. We find these lower rates of substance use, not just in tobacco, but even in alcohol use and some other drug use. So using the PATH data, I also was able to look at exposure to tobacco marketing and promotion. So I want to turn to that data now. And here are the rates of what our current tobacco users, so if they use any of those tobacco products within the last 30 days, and whether or not they received promotions from tobacco companies via the mail. This is sort of my indicator of snail mail, and then we have electronic mail. And there are two take-home messages here that we noted. In general, if you look at the column with women, is that women report receiving more tobacco promotions through mail as well as email than men, with the exception of gay men. So as a proportion of the sample, gay men were much more likely to receive tobacco promotion via mail or email. And this remained true after we adjusted for other demographic factors. So when we include things like age or race and ethnicity, whether they lived in urban or rural environments, and also the region of the country, we still find a robust finding that gay men are receiving these tobacco promotions at a higher rate. So what about LGBTQ youth? So this is the HRC data that I'm going to talk about very briefly. So what we find here is when we look at the risk of current cigarette smoking, so that's smoking within the last 30 days, and remember this is youth 13 to 17 years old, we find a couple important findings. One is that transgender boys had the highest risk of use. So this number here just indicates a probability. So we can say that transgender boys had 15% higher probability of currently smoking cigarettes than non-binary youth or cisgender boys or cisgender girls. And remember, these are all what we would consider LGBTQ populations. And when we look further at the way they identify their sexual identity, we find that bisexual and pansexual cisgender boys or transgender boys had the highest risk of current cigarette use. So when we dig a little deeper and we look at family rejection, it's a really important factor. And the youth who experienced family rejection were 15% more likely to smoke cigarettes. And we found that almost half of youth in this study of over 11,000 youth had experienced some type of family rejection recently. And we found that that this disproportionately impacted trans youth, and particularly transgender boys had higher reported rates of family rejection, which explains sort of that higher rate of cigarette use perhaps. And we also found that LGBT youth of color experienced family rejection at a higher rate than other youth in the population. So I want to end by restating sort of my original question about what identity has to do with it. And I think we have some evidence to lead this discussion forward from my own research that I conducted, but also from research from many other researchers that focus on this issue. And we find that there's a disproportional impact of tobacco marketing among, or even social norms of some of these other causal factors related to tobacco use among certain LGBT groups. And particularly cisgender, lesbian, and bisexual women are disproportionately impacted. And among youth, we found that transgender boys were particularly impacted, especially those who identify as bisexual or pansexual appear to be at higher risk. And we see some protective effects, or at least lower risk, lower exposure among asexual persons, and that includes youth and adults. And to kind of add a little complexity to this narrative, we also found that tobacco marketing was similar among straight and queer women, but seems to, for some reason, disproportionately target gay men. There's a lot of reasons for that. And one hypothesis that's been put forward is sort of what we used to call sort of the gay ghettos, where gay men aggregate in certain geographic spaces, and so that they're more vulnerable to tobacco marketing that may focus on geographic locations specifically. That's less true today than it was 10 years ago, but this may explain some of these findings. And also family rejection is increased risk of cigarette use among youth. And like I said, it seems to disproportionately impact trans boys. So I want to end with two sort of thought questions that focus on, when we're talking about tobacco marketing, how might exposure to that type of marketing explain these tobacco use nuances that I just reported? And I like to think of tobacco use as sort of cultural and symbolic meaning, or they have cultural and symbolic meanings for communities. So what are the symbolic and cultural meanings of tobacco use for LGBTQ+ communities? Is tobacco marketed as a way that youth can express certain types of identities or certain types of independence? And I think that question is still being explored and we don't have good answers to it. But with that, I'd like to move to the discussion and hear some of your questions. Oh, let me stop sharing my screen.
Thank you so much, Dr. Wheldon, for sharing your wealth of information. I'd like to thank all of our panelists and move into the Q&A portion. Are there any questions folks have in the chat about targeting of marginalized communities by the tobacco industry? Allie or Eric, can you all see if there's any questions?
I don't see anything yet, Selena, but I'm wondering if if folks want to just ask the question, if they want to unmute, if it's appropriate for folks to do that.
I think that'd be fine.
Yeah, so folks can just go ahead and unmute. If you have any questions for the panelists, feel free to ask out loud or you can write it in the chat.
Okay, Selena, so we do have a question here. So Stephanie says, thank you all for your work. What are the solutions here? What can leaders in the LGBTQ community do?
I'm going to say one of the things I think we really understand, and we actually understand it from a series of Pennsylvania needs assessments, is that when you ask our own communities what are our health priorities, we have a tendency to list tobacco as number 10. Even though epidemiologically, tobacco affects just a little under 1/3 of us and kills half the people that use it. So by the numbers, it is probably the #1 thing in our lives taking years off of our health. So closing this education gap between us even realizing that tobacco is a health problem and that we have targeting, and that we have been targeted because we have, discrimination-based vulnerabilities, which make it easier for them to make money off of our lives, I think is really helpful. So, I asked the question because I think that education gap is really built because lots of tobacco control programs don't target us. Luckily in Pennsylvania, there have been a series of different programs that are starting to include LGBTQI+ folks, but imagine how long has that been happening versus how long HIV programs have been funding our work, So we know that there's a huge growth for the public health world to continue to build this awareness, and then also with our own organizations too. Do we have options for getting funding for educational campaigns? And if so, what kind of educational campaigns are we putting out there so we even understand that this is a health priority and have our radar up the next time we see target materials,
Thank you. I'd like to jump in. I would be interested in knowing if any of you are interested in partnering with, like, let's say, for instance, the LGBT Commission on hosting some more events around the anti-tobacco work. Particularly, I know before this, we were talking a little bit about possibly hosting some sort of viewing party of your short film, Lincoln, and maybe having a Q&A session around that. But I would love to talk more about and kind of envision what that might look like to host something like that for Black and Brown folks within the LGBT community, because I think this is an important, this is something where we can really touch down and kind of dive in and focus on the intersectionalities of this work. So I'd love to be to explore that. I think we have a few more questions in the chat.
So we have a question here from Sean McCormick from the Health Promotion Council, who asked the question for Dr. Wheldon. Do you think identity could inform cessation and treatment program design, dissemination, and access? If so, how?
I think that's a good question. I don't have perfect answers for that. But when we think of identity, I would say that we would think of what the determinants of the tobacco use for those certain subpopulations are. So we know that bisexual people experience different types of stigma and discrimination, even within the LGBT community. So addressing those triggers potentially for tobacco use in terms of minority stress would be different than for sort of maybe a cisgender gay male audience that would require something different. So I would just say that the more we can tailor our cessation programs to the needs of the community, and you can use identity in order to sort of target those communities a little bit better and to address those needs. Now, how we actually do that, I think we need more research. One of the unfortunate facts is that we don't really have any targeted tobacco cessation programs that have undergone sort of rigorous scientific testing. And there was one that was done out of, I think it was Illinois University, that didn't show that it improved cessation rates at any higher rate than sort of the standard of care. And that was a group-based treatment where people were going to an LGBT community center. I'm really interested in maybe how we could leverage the strengths of our public health infrastructure around, for instance, HIV. So we've done a lot with regard to HIV. A lot of the funding from the NIH has been around HIV. Is there a way that we could take some of these other health issues that are impacting our communities and integrate those into sort of the infrastructure of HIV? So could we integrate tobacco cessation into PrEP care and management, for instance, or for testing? Can we integrate it in some way that increases the reach to underserved populations within our community? So I think when we think about identity, it's not a silver bullet. It just gives a glimpse into what maybe the important factors might be and how they are really diverse within what we call the LGBT community. It's really diverse communities that are regionally based, but also the social networks of those groups are very different as well, which affects how norms of tobacco influence our behaviors.
Sorry, let me just add a quick note onto this is, first of all, we just got new news from CDC today that LGBTQI folks are half as likely to be used evidence-based cessation programs as other folks. And that we've seen that there's a lot of resistance to calling these quit lines, things like that. So if we don't do more identity-based targeting, we are always going to be, our cessation gap is going to be huge. And just another note, actually a plug for something that's coming down the pike. HRC is working on a PowerPoint a webinar that will be coming out in mid-January, I believe now, on specifically African-American and Black communities' impact related to COVID, HIV, and smoking. So watch for that and we'll keep you apprised as that starts to come out.
Great, thank you. I know we are getting close to our time. I think we've got about 5 more minutes. Are there any more questions in the chat?
Yes, so we have a follow-up from Sean McCormick, who says, we're doing some of that HIV tobacco cessation integration. Great answer, thank you. We just don't want to come across as pandering or cheesy when delivering content for specific populations, hence our partnership with Trusted Orgs. And then Jackie says, Jackie here from the nonprofit org Counter Tools. What are the best ways to conduct counter marketing campaigns and messaging against the industry? Is this best done through films and videos? Is it best done through ads? Is it on the ground conversations with community members that can change the course, etc.?
I'd say all of the above, probably. I think specifically, Jackie, I think there has been a lot of work around, like engaging community members authentically. So I would say, specifically in my point of view, Black Lives, Black Lungs, like there's like the Richmond Department of Health put it on bus ads, and like there's other ways that they got the film out. But yeah, I would say listening to young people, especially around digital storytelling creativity, is always great. And going with organizations that are part of their communities and making sure that you're not just creating things to create them, but you're creating them based on the need after talking with the community and things like that would be my advice.
I would also just note that I think we need to hold our funding agencies responsible for this. I didn't know that the FDA pulled the plug on This Free Life, but I'm curious of like why that was done, and was the program not effective or something, or is there a political culture that has deemed that to be, that's the type of questions we should be asking, because the role of the FDA, the NIH, the CDC is to protect all of us. And if we have changes of administration that may be less conducive to those things, that shouldn't change the work that those agencies are doing.
And yet it did.
Yeah.
Absolutely.
Actually, it's interesting. Smokefree.gov still has an LGBT landing page, and it's hidden. Unless you know it exists, you can never find it. So if you want to have fun, I'll put it in here. It's smokefree.gov, and you'll see it's amazing, /LGBT. But unless you know it exists, you can never get to it, so no one goes.
I did advocate for them to move that. I was at the NCI before I came to Temple, and there was resistance on that for some reason, because when you go to smokefree.gov, you have smoke-free vets, smoke-free women, you have these other groups that are mentioned there, but then in order to find the smoke-free LGBT, you have to kind of go down a rabbit hole. But
that's interesting.
So this actually leads into, I think, our last question for the evening, which says, thank you all so much. Where can we access materials to share on networks? Thinking of the posters and videos. So are there other links that we should be knowing about that folks can post in the chat for everyone?
We have some of those shareable materials we talked about that we made totally free for anybody to use. And I will put our, we have a resource library. You can search through things, and then you can also email us if you just want to get the information where it is directly.
All right, well.
And I just posted the link to the full 15-minute film in the chat as well. It's free on YouTube.
Thank you.
Yeah, so really quick, I just want to thank everybody for coming out tonight. My name is Rashana Thomas. I'm the Tobacco Special Projects Coordinator for the Philadelphia Department of Public Health, the Division of Chronic Disease and Injury Prevention. You could have been anywhere tonight, but you are here with us, so thank you. A special thanks to our guest panelists and our guest facilitator. Thank you, Selena. Thank you, Dr. Scout. Thank you, Dr. Wheldon. And thank you, Lincoln Monday. I will keep you all posted on future events that we have in the future if you all are interested. And also really quick, don't forget about the Great American Smokeout, which is happening this Thursday, November the 19th at 12 o'clock. So a lot of great resources. And also really quickly, we are in the middle of a pandemic, and everybody is kind of quarantined, socially distanced. If anybody needs help with tobacco use, we have a quit line here in Philadelphia. It's 1-800-QUIT-NOW. Please utilize it. There are trained tobacco treatment specialists on the other end of these calls waiting to help you and address all of your concerns. So please don't be shy. Don't be a stranger. Again, my name is Rashana Thomas.
I was trying to get my trans mask. So honored to be here with you all. I really appreciate it. So happy you're doing this.
Thank you, everyone, and thanks, Selena.
All right, thank you all.
Thank you.
Have a good night.